Dr. Amy Compton-Phillips is here now. She's the Chief Clinical Officer of Providence, which serves 7 states, mainly in the West. Doctor, thanks for being here. We've seen the success you've had and others aren't having. What can they learn from you?
Well, thank you for asking. And we are thrilled to be on the forefront of being able to give out these vaccines. All along with COVID, we've been thinking that planning is the antidote to panic. And we actually started back in September saying what's going to happen when and if. We knew a vaccine was coming. So we started thinking about how we were going to manage that. We didn't know exactly what the rules were going to be, but we knew that we needed tools to help us identify what of our caregivers were at the highest risk. How could we validate our data, and how could we then use that data to reach out to people using tools of the 21st century, things like texting and email for those that prefer it, to be able to get them in. And so because we did that planning and we started the rollout, as soon as the CDC said they were ready to go, we were ready with our capacity to start notifying our caregivers to come on in and get tested or get treated with the vaccine.
For states and groups that find themselves way behind and in many ways not sure exactly how to catch up, is there some bit of information that you could offer to say, this will help you?
Yeah, just getting started, we knew that what we had was good enough. And in fact, we built a tool, and honestly, it was very quick, within the course of a week, called our Validate and Verify tool that had all of the information in our healthcare system about roles and work location, everything from doctors to housekeepers to respiratory therapists to IT people, right? So that's a role, work location, where do you work? But we know that data systems are notoriously imperfect. And so we said, we've got the information we can pull out. How do we take that and actually validate it? So then we asked our people to say, we have this information on you. Is this the right information? Do we have something wrong? Does your role or your work location put you at higher risk? And because we did that, we really circumvented a lot of the consternation that you've heard about at other organizations that have inadvertently, despite their best intentions, left out key groups of people that should be getting immunized. So I think the biggest lesson that we'd have is don't hesitate to start doing something. Some immunizations are better than none. And to ask your people, make sure that you hear from them, not just trusting the data.
But Dr. Compton-Phillips, we're running out of time, but a lot of your workers are refusing to take the shots, like 1 in 5 in one particular hospital. Why is that? And what do you do about it?
Well, in the hospital that you're talking about, it's in an area that is more underserved. It has a significant number, it serves an immigrant community particularly, and many of the workforce that are declining the immunization aren't necessarily the doctors and nurses, but they are the housekeeping staff and the nutrition workers. And so we need to do a really good job. And what we're doing right now is trying to understand what are the barriers there. We know that there is vaccine hesitancy, in particular in certain underserved communities of color that have less trust in the healthcare system. And so we're partnering very deeply with them to understand those concerns and make sure that we're addressing them so that we can really convince people to do what is in their best interest, which is protect themselves from this virus.
And Phillips, bless you and thank you and all the best to all the first responders and people who take such good care of us. We are forever indebted. Thank you again. Shepard Smith here. Thanks for watching CNBC on YouTube.